Knock, knock. Hi, my name is Danny. I'm going to be your nurse today. I'm going to go ahead and provide some privacy. Okay, I'm going to do some hand hygiene. Okay. How are you doing today? Good. Okay, I'm going to verify your identity. Can you tell me your name and your date of birth? Perfect. Okay, so today we're going to give you an antibiotic. So what that does is going to help treat your infection that you have going on. It's going to run through your IV. We'll just kind of run it intermittently, and if you start feeling any different or having any issues with that IV site, make sure you let me know right away. Do you have any allergies that we need to be aware of? No? Okay. Okay, so I have already verified my order when I pulled it out of the Omnicell. And I have verified it twice against the order. Provider put in that order for me. When I pull these out, I'm going to make sure that we have unexpired IV fluid, that there's no sediment in there or anything like that. I'm also going to do the same with my antibiotic. We're going to look at the expiration date to make sure it's the right time. I'm going to go ahead and compare that again against my computer here in the room at the patient's bedside. So everything here looks good. We are giving the right antibiotic. We're going to do our 6 rights. We have the right patient, the right medication, the right dose, the right time, the right route, and then the right documentation at the end. So I've gone ahead and done that. Again, I verified her identity using her wristband and asking her her name and date of birth. And we are going to go ahead and get started. So I have gotten all of my supplies here. I have a primary tubing, I have a secondary tubing, I have a flush because we need to check her IV before we hook it up, some alcohol pads, and then the medication. I'm going to go ahead and put on my gloves before I start preparing this. And we're going to start with our primary IV. Now, if the doctor has not ordered a primary IV to be run continuously, we're just going to get a small bag as a carrier fluid and run that through our primary line. So we're going to grab our primary IV tubing, go ahead and open that up. You're going to notice it's all wrapped nice. We're going to take all of that off. First thing you ever want to do when you open your IV tubing is make sure you clamp it with the roller clamp right away, otherwise we're going to have a big mess. This blue part here is just a shield. We can go ahead and take that off. Now I have my primary tubing. I'm going to take my spike at the top of my IV tubing. I'm going to take the shield off of that. We're going to go ahead and take off the cover of the primary tubing, and we're going to spike our fluid here. Make sure that spike goes in all the way. We can then go ahead and hang up our primary IV fluid here. And we got to prime this line because it's full of air. So before we hook it up to the patient, we'll make sure that it's full of fluid. First thing you want to do here is squeeze your chamber and make sure that you have your chamber filled about halfway full with your fluid. Now we can go ahead and stretch out our IV tubing here. And we're going to go ahead and use this roller clamp. And we are going to open that just a little bit, and you can see the fluid running through. You're going to run all of that fluid all the way till the end until there's no air bubbles in there. Okay, and then you can go ahead and re-clamp it with your roller clamp. Now we can go ahead and put this into our pump. So we just open our door to our IV pump using that lever. We're going to put the round blue part into the round top part up on the top of the pump. Just set that in there. And then this square part of our IV goes into the blue square part down at the bottom. And you can go ahead and push that in. Close our door. And now our primary tubing is ready to go. I'm going to hang that up there for now. Now we need to get our secondary ready. Sometimes with our secondary, our bags will come up pre-mixed from pharmacy. Sometimes it'll come in 2 pieces like this. So you'll have your powder antibiotic and a small saline bag to mix it with. If it comes up in 2 parts like this, we have to connect them and mix them. So what we're going to do is we're going to go ahead and flip off the top of our antibiotic, and we're going to take an alcohol pad and clean that off because it is not sterile. So you're gonna clean that vigorously. And then this silver part on our antibiotic fluid bag just gets popped off, and there's a little spike in there that gets exposed. What we're gonna do is we're gonna push that spike into the rubber topper of our antibiotic until it kind of clicks, and it'll be like that. Now to mix these, you have to break this seal between the antibiotic and the fluid. So we're gonna go ahead and break that seal, and I kind of twist it around to make sure it's good and broken. Now we're gonna go ahead and squeeze some of this fluid into our powder, so that way we can make it a fluid, because we can't give powder to our patients. And so you squeeze some fluid in, and then I turn it upside down, and I go ahead and shake that a lot until all of that powder is dissolved in that vial. Now, to get this fluid back into our bag, we'll hold it upside down, and you're gonna re-squeeze your bag, and it goes ahead and sucks out all of that fluid from that vial, okay? Now we have a nice mixed antibiotic bag, and this is what we're gonna give our patient. So we go ahead and take our secondary tubing. You're gonna notice that there's a hook in this secondary tubing. You do need this hook, so don't throw it away. I'm gonna go ahead and hang it on my pole for now. Notice that the secondary tubing is much smaller and shorter than the primary tubing. That's because we don't have to go so far. So we're going to, first thing we do with any IV tubing is we're gonna clamp it with the roller clamp right away so we don't lose any of that fluid. Now we can go ahead and hook up our secondary tubing to our antibiotic here. So I'm gonna go ahead and pull that off. I'm gonna take the shield off of my spike, and we're gonna go ahead and spike that fluid, okay? Now, instead of forward priming this like I did with my primary line, we're going to back prime this. So how we do that is I'm gonna hang this up here for right now. This secondary tubing always gets hooked to the port above the pump because we want the pump to be able to control our rate. So if we hook it below the pump won't control it. So we have to hook it up above the pump. I'm gonna go ahead and clean that port above the pump with alcohol. Okay, and then we can go ahead, take off this end of our tubing, and we're going to put it into that pump or to that port and screw it on. Now, this is full of air yet, right? And so we're gonna go ahead and take this antibiotic bag down, and we're gonna hold it below the level of our primary line, and we are going to open this roller clamp, and you're gonna see this primary fluid is now priming my secondary tubing for me, so I don't risk losing any of that medication. So you want it to fill to about halfway. Don't worry if you fill it too far, right? If that happens, we're gonna go ahead and clamp, and we're gonna turn it upside down and squeeze some of that fluid back into our primary bag, so that way I have a half full chamber and I can see it dripping. Now, one thing that you wanna make sure that these two things are compatible. So you wanna make sure that your antibiotic is compatible with your primary fluid. To do that, you can look in a drug book, you can look in LexiComp, you can ask a pharmacist. But if these two are not compatible, we need to get a different bag of primary lines so that they aren't mixing. So now we are ready to go ahead and hook up our patient and start our antibiotic. Okay. So first thing we need to do is we need to check her IV site and make sure that it is patent and there's no infiltration. So we're gonna come up to the IV, we're gonna go ahead and clean that port really good with alcohol, and then we're gonna take our saline flush and we are going to hook that up, and we are going to flush a little bit into her IV, and you can draw back to see if you have blood return in there, and make sure you flush that whole thing, at least 2 to 3 if it's a peripheral. If it's a central line, you want to give the full 10. So her IV looks patent, there's no redness, there's no infiltration or anything like that. So I'm going to grab the end of my primary tubing here that we had primed earlier, and we are going to go ahead and re-clean this port. And then I'm going to hook up the end of this tubing into her IV right here. So now that we have all of our lines primed, we have it hooked up to our patient, I'm going to go ahead and take my primary bag of fluid here, and I have to hang that lower than my antibiotic. The reason being is because the pump is smart, but it's not so smart that it knows which one to pull from first. So it's always going to pull from gravity. So the higher one up gets pulled first, and then it'll revert back to the lower one. So that's what our hook is for over here. I'm going to go ahead and hang my primary tubing lower than my antibiotic. So now we're going to program our pump. And so this middle part here is called a brain or a module. And then we're going to have a channel over to the side. Each one of these brains can hold up to 4 modules. So make sure you're looking at which one you want to program through. So for example, my channel that I want to program my antibiotic through is B. So we're going to make sure we have a B over on our module here. So to prime this, we're going to go ahead and hit channel select. So whichever channel you want to program, you're going to hit that channel select. It'll come up with a list of options. For now, I'm just going to do a basic infusion. So it'll ask you for a rate. So we're going to first program our primary IV fluid. So let's say the doctor gave us an order that he wants to run normal saline at 125 an hour. So I'm going to click on my rate button. Keep in mind this isn't a touch screen, so you have to click the button that's closest to whatever you want to program. I'm on rate right now, so he said 125 an hour. So I'm going to go ahead and put in 125. Now VTBI underneath of that stands for volume to be infused. So how much of our primary fluid do we want to go into our patient? Typically, if it's a continuous infusion, we're going to program it for this entire bag. This is a 1 liter bag. However, I want to give myself a little bit of warning that it's going to run dry. So that way I don't run air into my tubing and it gives me time to just go grab another bag. So I'm going to go ahead and program it for 950. That way it'll beep at 950. I have a little bit left in that bag. I can go grab another bag. So then you can go ahead and click start. Now one thing I forgot to do here was unclamp my roller clamp. So it's going to beep at me saying it's occluded. I'm going to go ahead and undo that roller clamp, and then you have to press restart over on that channel. And then it should be running. We're going to make sure that our tubing is dripping in that chamber. Now to program our antibiotic, I'm going to hit that channel select again because I want that antibiotic to go through this same channel. Down at the bottom, there's a secondary button. So this is a secondary line, right? So we're going to hit secondary. It'll either pull up a list of medications that you can choose from, or it'll just come up with a rate and volume to be infused, just like we did with our primary bag. This one happens to have a drug library in it, so we're going to go ahead and click our antibiotic, whichever one it is. We're going to do that, and then I want to do 500 milligrams in 50 milliliters. That's what our drug is. It's going to ask you to confirm that. I'm going to say, yep, that's really what I have in here. I double checked, triple checked. So I'm going to hit yes. And then down at the bottom, there's a next button. It just has you kind of reconfirm that that's what you have. I'm going to click next. So it already gives me a 50 milliliter volume to be infused. That's what's in here. It does ask for how long you want to run it over. So let's say I want to run this medication over a half an hour. So I'm going to go ahead and run that at 30 minutes. And it says our rate then is 100 milliliters per hour since we want it to go over 30 minutes. Then we can go ahead and click start down at the bottom. Make sure that your roller clamp is open on your antibiotic as well. And then you're going to make sure that it is dripping before you leave the room. A lot of nurses forget to clamp this, and then it just pulls from or unclamp it, and then it just pulls from the primary, and then we didn't give our antibiotic, and then we're off on our antibiotic schedule. So So that is dripping. Once all of these 50 milliliters are done, our pump is smart enough, it will revert back to our primary rate of 125, and it'll start pulling from our primary bag. One thing is with your antibiotics, you want to make sure that you do program these for the entire amount of the antibiotic, because we want that entire amount to go through before it goes back to the primary bag amount. Once this is done, if you wanted to shut it down, you press and hold channel off on the channel and then let go once it beeps, and it'll shut down your pump for you. So we have our antibiotic running, it's good to go, it's dripping. I'm gonna check back in with my patient. Are you still doing okay? I will stay with her for a few minutes just to make sure she doesn't have any reactions or anything like that. Double check her IV site, make sure it's not infiltrating. While I'm staying with her, I'll clean up my area and make sure that we have everything picked up. We'll also, while we're kind of finishing up, want to make sure that we have our tubings labeled for our IVs. Anything that is running continuously, you will change out every 3 to 4 days depending on hospital protocol. Anything that is intermittent, like our antibiotic tubing, or if we were to unhook her for any reason, we have to then change out that tubing every 24 hours. So make sure that you label that with date and time of when you hung it. If you ever go into the room and that tubing is not labeled, please just change out the tubing because we don't know when it was placed. I'm again going to teach her that you have an antibiotic running. Please make sure to let me know if you have any issues, and then I'll also ask her for teach back as well as to what she's getting that antibiotic for, what she needs to be watching for, that type of thing. So I'm going to tidy up my room. I'm going to make sure that she has all of her belongings at her bedside here. I'll put up 2 bed rails just so she doesn't fall out of bed, and make sure her call light is in reach, and I'll teach her to, press that button if you ever need me, don't get up by yourself, that type of thing. And then also I can document if I have a computer in the room, otherwise I can document when I leave the room.